My name is Samuel Davis. I'm one of the physicians at Palmetto Bone and Joint, specializing in spine surgery. I grew up here in South Carolina, a small place called Andrews. From there, I went to South Carolina State for my undergraduate degree and then went on to Wake Forest for medical school. Left there and then went to Duke for orthopedic surgery. Thought about neurosurgery for a while, but orthopedic spine was just kind of more my taste. So stuck with that and then went to Emory for a spine fellowship, and there worked with some of the brightest and best surgeons in the nation, in my opinion. Sometimes there's a lot of trepidation when it comes to spine surgery. Everyone knows someone that has had one spine surgery that has led to 5, 6, or 7. And it's a common conversation for me, and I remind patients that not everyone's the same. Not every disease process is the same, not every surgeon is the same, not every surgery is going to be the same. My goal is to give them one surgery and get them back to doing the things that they want to do without any fear of being paralyzed or without fear of having multiple surgeries. It's kind of a one and done deal for me. When I first meet a patient, I really want to get to know who they are. Not necessarily what brought them to me, but who they are as a person. What do they like to do? What's their family dynamic like? After I introduce myself and ask them what their names are, I'll say, well, how do you spend your days? And I just let them talk because I want to get a sense of, again, who they are, what they're doing, and then get a sense of how whatever process is impacting their ability to do those things. And once I've gotten that information and really think about it, I can come up with what I call an individualized treatment plan for them. I always thought that I wanted to become a doctor. I initially thought about internal medicine or family practice. When I was, I think, 10 years old, my grandmother, who lived right behind us, not even 200 yards, came to the house. She slipped on our floor and broke her hip. Again, living in Andrews, rural place, my grandmother had some fear of doctors, had some fear of surgery, and so she never got her hip fixed. And for, probably the better part of 10 or 11 years, she had what we would call a painful non-union, and so she went from being an active person that drove, that went out in the yard and played with us, to someone that was pretty much bedridden and took some steps in the house with a lot of effort. And that really, it made an impression on me. And I always thought that, if there was something that I could do to prevent someone else's grandmother from having to endure that, it was certainly something that I wanted to try to do. And so that drove me to become an orthopedic surgeon.